Hi, my name is Dr. Rudra Mohan and through the Oral Health channel, today we're going to be talking about how to perform a self-mouth examination for oral cancer screening. Let's start. So this is a very comprehensive episode that I've made, and it is with my own example that I want to show you that you can do your own self-screening examination for oral cancer in 7 steps. It's as simple as that. Very simple 7 basic steps you have to follow. Mind you that if you're not a dentist, so definitely you need to understand that if you see anything out of the normal, you can contact the dentist and visit the dental office. The first that you require is a mirror and a good source of bright light so that you can see into your mouth. First thing that you need to do is you need to stand up straight in front of a mirror and then see if there are any sort of distortions or swellings or asimilarity between your left and right side of your neck, the chin, the jawbone and all those things, any sort of lumps or swellings that you can see to notice on the mirror. The second thing you need to do is to check for your own skin textures, any warts, moles or masses that you can see which have either grown very rapidly in the past few days, or there have been any sort of changes in them such as skin color, or the fact that there has been an ulcer or there has been a rash around that area. These things are very important because head and neck cancers are generally around the lymph nodes of the head and neck, and that is why you need to check for any moles or lumps or swellings. Now finally, before you even place your fingers in your mouth, I would strongly recommend wash them with soap and water so that they're clean before you place your hands in the mouth. All you need to do is basically take your 2 fingers and place it in your mouth, first to invert the lower lip to check for any lumps, swellings, ulcers, patches, any keratotic lesions, any non-scrapable lesions, anything out of the normal or anything out of the ordinary. Finally, you go around and go into the back where you finally touch your the buccal mucosa or the skin of the cheek. Try to find if there is anything different or out of the ordinary. It's usually pinkish in color. Some people might be having linea alba, that is the white line that is happening because they get a cheek bite. Otherwise, it's all right. But if you see something very much out of the ordinary, like a white patch or a red patch or a small nodule or a small lump or something that you can feel by pinching the skin against your fingertip, then you need to go to the dental office to get yourself checked out. Then you switch over to the floor of the mouth. That means the area below the tongue. Check for anything that is any sort of cuts, any sort of ulcers, any sort of swellings, any sort of nodules that you could feel out of the ordinary. Check for the surface or anything of that sort, because floor of the mouth cancers are very dangerous to treat. Also, you have to check the tongue by taking it out and swaying it right and left side to see if there are any ulcers, because most of the oral cancers that start in the tongue are usually on the lateral border of the tongue, that means on the side of the tongue. So check for any sort of whitish lesion, any red patch or any ulcer in that area. Then you have to switch over to the dorsal surface of the tongue, that means the front surface or the upper surface of the tongue. I have had my share of coffee and I have been having a little bit of dry mouth, so that's why the tongue is a little coated. But most of the times, most of people have some sort of coated tongue. It's not something to worry much about because you might be just dehydrated. And finally, take a bright source of light. Ask someone to shine the light in your mouth without taking your tongue out. Make sure that you are basically seeing the tonsillar pillars. So this was today's episode. Please like, share and subscribe, and do press the bell icon for important updates. If you want to contact me, here are my social media handles and my WhatsApp number. Kind of try to refrain from calling directly because I might be busy with patients. Just drop me a message and we can have a chat later on WhatsApp. Also, if you need to have any sort of queries answered on the YouTube videos or any other particular topic related to oral health, kindly leave it in the comment section of the YouTube channel. So that's it for today. Thank you.